Welcome, everyone. We're diving deep into hypothyroidism today.
Oh, yeah, it's a fascinating topic.
Absolutely. And to guide us through this, we have an expert perspective
That's right.
from Dr. Praveen Ramachandra.
A senior endocrinologist.
So we're going to break down everything about hypothyroidism,
Yeah.
why it matters, how it's managed,
Absolutely.
and you don't have to have a medical degree to follow along.
Yeah. You know what's so interesting about this condition is
Mhm.
you might not even realize
Yeah.
it's happening to you.
Oh, totally. So let's start with the basics.
Okay.
What exactly is hypothyroidism?
Okay, so you've got this tiny little gland in your neck shaped like a butterfly.
Right, thyroid.
Right, the thyroid.
Yeah.
And it's responsible for producing thyroid hormone.
Mm-hmm.
And that's a really crucial hormone.
Okay.
It's like your body's internal thermostat.
Okay,
It regulates your metabolism,
got it.
and it influences pretty much every organ you have.
Wow.
Hypothyroidism basically happens when your thyroid gland just isn't producing enough of this essential hormone.
So my body's thermostat is
Yeah.
stuck on low.
Exactly.
And what happens then?
It can lead to all sorts of problems, just like a house with a broken thermostat.
How-
Things start to go wrong in your body.
Okay.
The cardiovascular system is a major one.
Mhm.
But you can have digestive issues like constipation, brain fog, making it hard to concentrate,
Oh, wow.
even remember things.
That's wild. I never realized one tiny gland could have such a widespread impact.
It's amazing.
So is all hypothyroidism the same, or are there different
Yeah.
types?
Yeah, good question. So
Yeah.
the article breaks it down into a few different types.
Okay.
The most common one is primary hypothyroidism.
Mm-hmm.
That's where the problem originates in the thyroid gland itself.
So the thyroid factory is malfunctioning.
Exactly.
Okay. What are some of the other types?
There is central hypothyroidism, which is less common.
Okay.
And that's where the issue is higher up the chain of command.
Oh.
It's in the pituitary gland or the hypothalamus in the brain.
Gotcha.
And those control the thyroid.
So the thyroid might be fine, but it's
It's not getting the right instructions.
not getting the right instructions. Okay.
And then there's this rare one called peripheral hypothyroidism.
Mm-hmm.
And this is where the body's tissues become resistant to the thyroid hormone.
Oh, wow. So,
Even if there's enough
yeah,
circulating, it's just not working properly.
like the thermostat's working,
Yeah.
but the house isn't responding, right?
Exactly.
Okay, I see how this can get complicated.
It can. And then there's this really unusual one that caught my eye.
Mm-hmm.
It's called consumptive hypothyroidism.
Okay.
It's where tumors gobble up thyroid hormone,
Well,
leaving the body running on empty.
oh my goodness.
It's crazy.
Okay, let's talk causes then.
Okay.
What causes hypothyroidism in the first place?
It's like a detective story,
Mhm.
Kind of track down the usual suspects.
Right.
Often the culprit is Hashimoto's thyroiditis. It's an autoimmune disorder where the body's immune system attacks the thyroid.
So the body is attacking itself.
Oh, wow.
Friendly fire gone wrong.
So iodine's important for thyroid hormone.
Yeah.
Right.
It is, but too much or too little can be a problem.
Too much of a good thing.
Exactly.
It's backfire.
It can. And certain medications can interfere with thyroid function too,
Oh, really? Like what?
like lithium,
Oh, wow.
which is often prescribed for bipolar disorder.
It sounds like pinpointing the root cause of hypothyroidism can be tough.
It can be.
Yeah.
And it's made even trickier because the symptoms are so sneaky.
Oh, what do you mean?
Well, they can be really general, like fatigue, weight gain, constipation.
Right. I've done.
It's easy to brush those off.
Yeah,
It's just
right.
everyday life.
I've blamed my afternoon slump on too much coffee too many times.
Exactly. And this is where it gets really tricky for pregnant women
Oh, why is that?
because a lot of those symptoms overlap with normal pregnancy changes.
Oh, that makes sense. So it's hard to pinpoint, and a lot of women don't get diagnosed until later in their pregnancy,
Oh,
or even after they've developed complications.
that's scary.
It is.
So how do you know for sure if it's hypothyroidism then?
That's where lab tests come in.
Uh.
They're the gold standard for confirming hypothyroidism.
Mm-hmm.
They measure your levels of thyroid hormone and TSH,
Okay.
which tells us how much your pituitary gland is trying to stimulate the thyroid.
So it's like looking under the hood to see what's really going on.
Exactly. And that's where we'll pick up in the next segment.
Okay, can't wait to hear more about that.
Yeah, it's going to be good. Okay, so let's say you're experiencing those classic signs of hypothyroidism,
Mm-hmm. The fatigue.
the weight gain.
Yeah, the brain fog.
What's the next step? Well, the research really emphasizes advocating for yourself.
Right, because it's easy to just brush those off.
Yeah, exactly. It's easy to dismiss them as just everyday stress, but, your body best.
That's so true. I think we're all guilty of that sometimes.
Yeah, absolutely. But when do those everyday aches and pains become a sign of something more serious?
That is the question, isn't it?
It is, and the research doesn't give us hard and fast rules,
Okay.
but it does offer some clues.
Right.
One thing to consider is your risk factors.
Mm-hmm.
Do you have a family history of thyroid issues?
Okay.
Have you noticed any changes in your menstrual cycle?
Right. So look for those patterns.
Exactly. Connect the dots. Don't just dismiss individual symptoms.
Got it.
If you have multiple symptoms that have been lingering for a while, or if you have that gut feeling that something's just not right,
Mm-hmm.
it's worth talking to your doctor.
Absolutely. And don't be afraid to push back if you feel like you're not being heard.
That's right. It's your health.
Yeah.
As we talked about earlier, lab tests are the gold standard for confirming hypothyroidism. So
Right.
if your doctor isn't receptive to running those tests,
Mm.
it might be time to get a second opinion.
Yeah. You deserve to be taken seriously.
Absolutely. And speaking of lab tests,
Yep.
diagnosing hypothyroidism during pregnancy can be extra tricky.
Oh, why is that?
Well, because some of those classic symptoms like fatigue and weight gain are also normal during pregnancy.
Right.
So it can be really tough to differentiate.
Yeah. It all blends together.
It does, and the research actually mentions that many women aren't diagnosed until later in their pregnancy,
Oh, wow.
sometimes only after they've developed complications,
Like what kind of complications?
like high blood pressure or preeclampsia.
Oh, gosh, that's scary.
It is, and it really highlights the need for proactive testing.
Mm-hmm. Especially for women with a history of thyroid problems.
Exactly, or those who are experiencing unusual symptoms during pregnancy.
Early detection is key.
It really is, and speaking of early detection,
Oh, yeah.
that reminds me of congenital hypothyroidism
Okay.
and the role that newborn screening plays.
Right, where babies are tested for thyroid function shortly after birth.
Exactly.
Mhm.
And the research highlights this as one of the biggest success stories in newborn screening programs.
Wow, that's amazing.
It is because congenital hypothyroidism, if left untreated, can have devastating effects on a child's development.
So this simple test can literally change a child's life.
It really can by catching it. Early doctors can start treatment right away
What?
with levothyroxine,
Okay.
and that helps to ensure that the child's brain and body develop normally.
That's incredible. It's amazing what we can do with preventative medicine these days.
It is.
Okay, so we've covered a lot about the causes, diagnosis, and potential complications of hypothyroidism.
You have.
Now let's dive into what it actually means to manage this condition.
Okay.
So as we touched on earlier, the cornerstone of treatment is thyroid hormone replacement therapy,
Right, usually with a medication called levothyroxine.
levothyroxine.
Yeah.
Okay. And it's amazing how this synthetic hormone can basically step in and take over for the thyroid gland.
It is. It's pretty amazing.
But I know from the research that finding the right dosage is really crucial.
Oh, absolutely. You need to get it just right.
Yeah, and that's where the expertise of an endocrinologist is so important.
Yeah, they'll consider all sorts of factors like weight, age,
Mm-hmm.
other health conditions.
Right, to figure out the right dosage for you.
Exactly, to get your hormone levels back to normal.
Okay.
And to make sure you're feeling your best.
And I read that some people might need a higher dose during pregnancy.
Yeah, that's because pregnancy puts extra demands on the thyroid gland.
Oh, that makes sense.
Yeah,
Let's go
baby's development relies on the mother's thyroid hormone.
Right.
Plus, those hormonal shifts during pregnancy can affect how your body processes thyroid medication.
Oh, wow, so they have to adjust it.
Yeah, they might need to adjust the dosage to make sure both mom and baby are getting enough thyroid hormone.
To thrive.
Exactly.
Okay, now let's talk about something that's often debated,
Okay.
the treatment of subclinical hypothyroidism.
Ah, yes. This is where things get a little tricky. So remember, this is when your TSH level is a bit elevated,
Okay.
but your actual thyroid hormone levels are still normal.
Right.
And the research highlights that there's no one-size-fits-all answer here.
Okay, so it's not as simple as...
No, it's black and white.
It's not black and white.
It's about weighing the potential benefits and risks for each individual.
Okay,
It's a personalized decision.
got it. So what are some of the factors that doctors consider when making that decision?
Well, age plays a big role.
Okay.
For older adults, the potential benefits of treatment might be less clear,
Mm-hmm.
and the risks of overtreatment could be higher.
Like what kind of risks?
Things like heart problems or bone loss.
Oh, wow.
So it's a balancing act.
Yeah, weighing the pros and cons for each person.
Exactly. Doctors will also consider your symptoms
Mm-hmm.
and your overall health.
Okay.
For example, if you have heart disease, treating subclinical hypothyroidism might be more beneficial
Right.
because it could lower your risk of cardiovascular complications.
So it really depends on the individual.
It does.
Okay. So it's great that there are medications that can effectively manage hypothyroidism.
Mm-hmm.
But as we talked about earlier,
Yeah.
even with treatment, some people still struggle with symptoms.
That's an important point.
Right.
And it brings us to the concept of quality of life. It's not just about numbers on a lab test.
Right.
It's about how you feel day to day.
So it's about more than just getting those thyroid hormone levels in the right range.
Exactly.
It's about feeling good, too.
It is. And the research really stresses the importance of listening to your body
Yeah.
and not dismissing lingering symptoms, even if your thyroid hormone levels are technically normal.
You are your own best advocate.
You are.
So what can someone do if they're still feeling off despite treatment? Where do they go from there?
The first step is always to talk to your doctor.
Okay.
It's possible that your dosage needs adjusting, or maybe there's another underlying condition contributing to your symptoms.
Okay.
The research actually mentions that some people find relief with a combination of levothyroxine and another thyroid hormone called liothyronine.
Oh, so there are other treatment options to explore.
There are, but it's crucial to remember that any changes to your medication should always be made in consultation with your doctor.
Right. Don't just start taking things on your own.
Exactly.
Yeah.
They can help you weigh the potential benefits and risks and figure out what's right for you.
Yeah, this really highlights the importance of that patient-doctor relationship.
Absolutely.
Feeling heard and understood can make a huge difference in managing a chronic condition like hypothyroidism.
It can. It's a partnership.
Yeah, working together to find the best way forward.
Exactly.
I'm curious, from your perspective as an expert in this field, what are some of the most exciting things happening in hypothyroidism research right now? What are those frontiers that are really captivating your attention?
Well, one area that I'm particularly interested in is the role of genetics in hypothyroidism.
Oh yeah, genetics are so fascinating.
They are, and the research mentions that scientists are uncovering specific gene variations that could influence a person's susceptibility to developing hypothyroidism or even affect how they respond to treatment.
So do you think this could lead to more personalized treatments in the future?
Oh, absolutely. We're moving towards an era of precision medicine
Wow.
where treatments are tailored to an individual's unique genetic makeup.
That's credible.
It is, imagine a world where we can predict how someone will respond to a medication based on their genes.
Yeah, that's the future.
That's the future.
That's amazing.
It is.
The research also touches on environmental factors
Yeah,
affecting thyroid function.
it does. There's growing evidence that exposure to certain chemicals and pollutants, even at low levels, could interfere with thyroid hormone production.
It's like everything's connected.
It is, our health is intertwined with the health of our planet.
So fascinating.
It really is, and it begs the question, how can we protect ourselves and future generations from these potential risks?
That's a big question.
It is a big question.
Okay, so in this deep dive, we've gone from the basics of what hypothyroidism is all the way to the cutting edge of research. We've explored how it's diagnosed, the complexities of treatment, and the importance of taking a holistic approach that prioritizes quality of life.
And we've only just scratched the surface.
Right.
But I think the biggest takeaway for me is that hypothyroidism is more than just a medical condition. It's about understanding your body, advocating for your health,
Yeah.
and finding the support you need to thrive.
Absolutely well said.
Yeah.
Now, before we wrap up in our final segment, I want to leave our listeners with a question that's been on my mind.
Okay.
How can we, as individuals and as a society, do a better job of supporting those living with hypothyroidism? How can we ensure that they have access to the care and resources they need?
Yeah.
What can we do to make a real difference in their lives?
That's a powerful question and one that we need to address.
We do?
And we'll delve into that and more in our final segment.
Okay, can't wait.
Stay tuned.
We've been talking about the impact of hypothyroidism, and it's not just the physical symptoms, right?
Absolutely. It goes beyond that. Think about it. You're constantly fatigued, like dragging yourself through the day.
Yeah, it must be exhausting.
It is. And then there's the weight fluctuations.
Yeah.
That can really mess with your self-esteem.
Oh, for sure. That's going to be tough.
The research really emphasizes the impact on mental health and well-being.
Yeah, it's like this invisible struggle.
Exactly. It's not always obvious to others what someone's going through.
So how can people support loved ones dealing with this?
Creating a supportive environment is key. Family and friends, just being there to listen.
Yeah, just listening can make a huge difference.
Offering encouragement, helping out with practical stuff when they need it. It's those little things that show you care.
It's that empathy, right? showing up even when you don't fully get it.
Exactly. But it's not just personal support. There are bigger things to consider, like systemic changes.
What do you mean by that?
Well, the research got me thinking about healthcare access. We talk about levothyroxine as the standard treatment. But what if someone can't afford it? What about those regular doctor visits? The blood tests?
Oh, yeah. Those costs can add up.
It's a huge barrier. Having treatments is one thing, but people need to be able to access them.
Afford them to.
Exactly. We need policies that make healthcare more affordable and accessible for everyone, especially for folks managing conditions like hypothyroidism.
It's a social justice issue for sure. Everyone deserves a chance to thrive.
Couldn't agree more. And then there's awareness. The research mentions how easily those hypothyroidism symptoms get missed. They're so general.
Right. People might not even realize they need to see a doctor.
Exactly. We need to raise awareness, talk about those symptoms, push for early detection.
It seems like education is key on multiple levels, right?
Absolutely. Even within the medical community, there's still debate about the best way to manage things like subclinical hypothyroidism.
Yeah, the research highlighted that. So we need more research, more training, more open discussion.
For sure. It's all about making sure healthcare providers are equipped to give the best possible care.
It's incredible how much complexity we've uncovered with this one condition.
I know, right? But I think the takeaway is clear. We need a holistic approach. It's not just about treating a gland, it's about the whole person.
Physical, emotional, even their social situation. It's all connected.
Exactly. It's about going beyond managing symptoms and really improving people's lives.
Couldn't have put it better myself.
Well, I'm glad we could dive into this together. It's been fascinating.
It really has. And thanks to all our listeners for joining us on this journey into the world of hypothyroidism. We've explored the science, the struggles, and the hope for the future.
Remember, knowledge is power. Understanding your health helps you advocate for yourself, make the best decisions.
Absolutely. And until next time, keep diving deep into the things that matter to you.